to be here with you to talk, and I think it's very fitting that I'm going after my colleague from Michigan because I think we share the same philosophy. So my research center, the Eunice Kennedy Shriver Center, was named after the sister of President Kennedy. She's the person who started the Special Olympics, and like Elizabeth Center, we're a university center of excellence in developmental and related disabilities. We've had an emergency preparedness and response initiative since about 2005, based on the negative experiences people with disabilities had during September 11 and also in 2005 in Hurricane Katrina. Our projects focus on the disability community and also on responders, but today I'm going to be talking about disability community projects. A little bit of background, you all may know we have a strong civil rights law, the Americans with Disabilities Act, and that law gives people with disabilities equal access to emergency services, and it says that those services have to be delivered in the most integrated setting, and so that means for most people with disabilities, they should be going to a general population shelter. The law requires what we call reasonable modifications or changes to enable participation of people with disabilities unless those changes would fundamentally alter the nature of the program or impose undue burdens. But a community can't just say, well, this is costly to include people with disabilities. That's not what undue cost means. It has to be something more. And also the law says that we can't have one size fits all. That means that we can't have one way to give emergency services to people with disabilities because services have to be a bit more individualized. So despite this really wonderful law, there are problems and gaps in implementation. Some of the issues have been inaccessible emergency warnings and alerts, people with disabilities being abandoned during evacuation, inaccessible emergency services, refused emergency services, that happened to my own family, and separation from vital supports. This is the real puzzler to me because if my daughter is separated from her adaptive equipment or from her parents or from a caregiver and she's in a shelter, that's going to mean a lot more work for shelter personnel. And when I train responders and shelter personnel, I point that out. You want to keep people together with their equipment. It's not just the law. It's going to make your life easier. Some of the negative results have included lost access to health care and social services, medical conditions worsening, new medical conditions being developed, and no surprise, the really big one, lost independence. So all of our projects, either on the responder side or the disability community side, are meant to address these gaps. And though I should say the situation for people with disabilities and emergencies is improving, in fact, somewhat dramatically in the States, there are still issues to be addressed. So one type of training we have is a training for self-advocates. And we use that term to mean young adults and adults with intellectual disabilities who speak for themselves and make their own decisions. We developed this training in collaboration with a self-advocate, and he's our trainer. And he goes out to train different groups. The focus of the training is on the likely experiences. So what's going to happen in a power outage? We have those a lot in my state during storms. What will it look like? And what key steps should people with intellectual disabilities take? He's also developed some related resources, and he's trained over 1,000 people in Massachusetts, Rhode Island, and Delaware, and he's about to move forward with 4 states and train them by webinar, via GoToMeeting. Much like my colleagues' trainings, we have pictures and limited text in these trainings because of the reading level of our audience. And this is a screenshot from one of the self-advocates trainings. He asked the question, how do cities, towns, and counties share information about emergencies and disasters? And the participants can respond by looking at the pictures and talking to him about the pictures. We also have a parent education training, and much of those materials are on our website. Again, developed in collaboration with parents and responders, addressing the needs both thought should be addressed. And the focus is on what-if thinking and planning and sharing need-to-know information. What-if thinking and planning is, for example, suppose my child uses a power wheelchair. Suppose I can't power the battery during an emergency. What's my plan? Need-to-know information is information that a responder or a neighbor would need to know to help my child if my child couldn't speak for themselves or if I wasn't there. Our evaluation was positive and showed significant knowledge gains and high satisfaction, and the training is being translated into Japanese for dissemination to parents of children with disabilities in Japan. This is a slide of one of the parts of the emergency template that we created. Again, it's available on our website, and I'll give you the link at the end. And you'll notice there's a part in yellow. That's to draw the eye. A parent came up with this. She wanted the responder or the neighbor to look immediately at the information in yellow, the most critical information to know about the child. And in the training, we go over our emergency plan template and we talk about how to fill in this form and the other forms, and we have a checklist that guides parents. We also have a kind of program that I would call training by doing. There's a lot of gaps in local emergency plans, so we developed what we call the community stakeholder meeting, which is really a process by which local folks with disabilities and disability community representatives and local responders and emergency planners and public health personnel get together, look at the local emergency plan, see if there are any gaps, and if there are, and thus far there always have been gaps, they make a plan to address those gaps. So prior to that, there's a responder training. The CSM, as we call it, is a 3-hour in-person meeting, again developed with strong stakeholder collaboration, and it was piloted by a group of folks with disabilities and responders. And you see on the screen a screenshot of our workbook. We developed a workbook guide so that in the future, the community wouldn't need us to come in and facilitate. They could follow the steps of the guide. And we're working now to put that guide online. Again, evaluation is positive. No big surprise to the Americans in the room. All of the localities identified at least 5 gaps. They also found generally low-cost ways to close the gaps. In our knowledge measures, there was a significant increase in responder knowledge. And a nice side benefit, although it was not the main goal of the project, 95% of disability community participants reported increased motivation to take additional preparedness steps just by participating in the meeting. So some lessons learned. The disability community and the response community are really 2 different cultures. And in the US, they don't always know each other. So part of what we have to do is to bring them together. Education, we think, should not just be about raising awareness. We need to share some facts, but we also need to provide actionable knowledge you can act on. So we teach responders a series of steps we call the ORS steps to help them remember how to act appropriately with people with disabilities. And we teach people with disabilities about concrete planning steps they can take and how they can be active with their community on local emergency planning. My colleagues said this, I'm going to repeat it. Stakeholder engagement is absolutely key. As I have shown you, a parent came up with something that no one else in the group came up with in one of my projects, and this keeps happening, that a stakeholder will come up with an idea no one else has thought of. Just the fact of being involved in one of our planning committees and reviewing our materials itself builds inclusion and awareness. And again, it's not a surprise to this group that inclusive emergency planning builds on disability community strengths, and it enhances community resilience for everybody. Because if you're prepared for people with disabilities, you're prepared for the whole community. Systems change is the ultimate goal, and what our projects aim to do is develop greater equity for the disability community and, of course, efficiency for responders. So this is my contact information and our website. I also have some business cards I can give you. We have a lot of resources available to the public on our website, and I brought some materials with me. I'm going to stop here and see if there are any questions.
I would like to ask one question. Does action on people with disabilities make on federal or state level obligation to have the preparedness for disaster occasions?
Can you explain your question a little bit more? I don't think I understood it.
At the beginning of you mentioned the act on people with disability, okay? Mm-hmm. And the law. Okay. Does it make any obligation that from state on federal or state level to make preparedness to emergency situations?
I understand exactly what you're saying. So the Americans with Disabilities Law does not make obligations on people with disabilities to prepare. I actually don't know of any law, I believe there is none, that requires preparedness. What we teach is that good practice necessitates preparedness, and that because emergency responses at the community level in the United States, people want to help out their community, and they can help their community by preparing. And when I meet with responders, that's a message they want to be able to share, so that you shouldn't be at home just waiting for the responders to come get you.
So it happens on voluntary basis?
Yes.
Okay.
Yes. Thank you.
Thank you very much.